My name is Catherine, and I'm a social worker here at the Recovery Center. I've been working here for about 5 years, and I do counseling with individuals and with groups of people who are recovering from drug addiction. I really enjoy my job, and I feel like I'm really lucky to be able to help people. I'd like to know some things about you guys, so I was hoping you'd tell me your names, something about yourselves, what you do, your family, and then maybe tell me one thing about yourself that you think might be a strength, something that would help you get through this program. Ladies first.
My name is Leah. I'm 26. I have 3 children, 2 girls, 8 and 5, and a little 2-year-old boy. I'm here because I have an addiction to painkillers, which caused me to lose my children. I currently have a job at Sam's Club. I have hopes of becoming a better mother and being able to get my children back. And I feel like my strength and motivation are that, getting my children and being someone that they can be proud of and look up to.
Well, that's good. That's a good place to start. I hope you feel that way.
My name is Johnny Sellers. I'm a maintenance man for a physical rehab place. I have 4 kids, 3 grandchildren. Grew up in a divorced home. Father strict, mother not strict at all. Went from one extreme to another, and that's probably why I'm where I'm at now.
What do you think might be a strength for you, Mr. Sellers?
Dependability.
I think that's a pretty good strength too. I also wanted to take a minute to tell you guys that just because you're ordered by the courts to be here, that doesn't mean that your presence here is not significant. A lot of people that get court ordered don't even bother to show up. So it's important that you're here. And the fact that you have the courage and that you're willing to at least try is something that you can look at as a strength, you know. Anything that you say here is confidential, just so you know. Okay, so let's talk about addiction. That's why we're here, right? Okay, in this group, we focus on understanding addiction in terms of the biological factors and the environmental factors that influence it. And the goal is to use that information to maybe develop some strategies that will help you not use in the future. Make sense? Any questions so far? I always like to begin by looking at the biological factors and then moving into the environmental factors. And we'll get as far as we can into that information in this meeting as much as time will allow us to. Okay, so let's start out with just some basics about addiction. Why do people take drugs? Why do people drink alcohol? What makes them do it in the first place? Some people do because of trouble at home. This is probably something that everybody can understand. Maybe you're fighting with your wife. Maybe you're overwhelmed by your children. Overwhelmed by the stress of being a good parent or being a good spouse. Or maybe when you were a kid, your parents were drug addicts and that's just what you learned to do. Some people do because of mental health problems. Some people may be depressed or bipolar, and it's a form of self-medication for them. Maybe they don't have access to their medication, or maybe their judgment is impaired because of their mental health, and that's why they choose drugs or alcohol. Some people do because of trouble at school, work, or because of their friends, like peer pressure, you know, hanging around other people who use drugs, adolescence, peer pressure, or like if you're an adult and you're at like a work mixer or whatever, you see other people drinking, so you do, you know, just do what everybody else does just to fit in. Some people do because it's what they've always done. It's what they've done since they were young. And most of the time, what you do when you're young extends into your adulthood. Your eating habits, just the way you look at things. If you use drugs when you're young, chances are you're probably going to use them when you're older too. And our biology. Everybody's bodies react to drugs differently. Some people like the feeling the first time they try a drug, and they want more. They want to get that feeling again. They keep on trying to get that feeling again. Most time not successfully. Other people hate how it feels and they will never try it again. Any questions about that, you guys? All that makes sense to you? Good. Okay, so how does casual drug use become an addiction or a dependency? So here is your brain on drugs. So most of the time when people use drugs the first time, maybe the first couple times, it's because they just decide to do it for one of these reasons that we talked about. Maybe something simple. Maybe they just want to see what it feels like. But after prolonged drug use, physical changes to the brain can occur. And when those changes occur, it can make it difficult to say no, or it can impair your judgment. It can also make you crave drugs, and then you end up having to do them just to feel better instead of just trying to feel good for that first time.
What is the high and low?
The high and low? Okay. That's just differences in differences in blood flow.
Okay.
Right? So in the normal brain, you get more blood flow where it's darker. In the abnormal brain, it's just flowing to different places, not flowing to different places. So okay.
Does it impair your ability to make choices?
Yes.
Yeah. So
Impulse control too. Decisions and impulse control, especially in your frontal lobe. Okay, in here.
So when you're taking these drugs, you're hurting your ability to say no to.
Exactly, yeah. So when you first start out, you're just doing it for fun. Then afterwards, you're just doing it because your body's telling you that you need to do it. And your body's telling you that you need to do it because this is controlling you. Does that make sense, Mr. Sellers? Great question, Leah. There are other genetic components. Well, genetics are another biological component to addiction. And this is about a study that was done on twins. Oh, that's not yours. This is yours. Okay, so this study focused on, looks like 800 sets of identical twins, 653 sets of fraternal twins, and it showed that when one of the identical twins was an addict, his sibling was 50% likely to be an addict, as opposed to the fraternal twin, much less more likely to be an addict. And these results show that addiction does have a genetic component, so it is inherited. And these studies, these results were also duplicated in other studies. So it's not just like one time they got these results. I mean, they've demonstrated it. So research is changing. We're understanding addiction more. And the more we understand, the more tools we can develop to work with it, And if you look down at the bottom where the children of addicts are 8 times more likely to develop an addiction, and you remember when we looked at our risk factors. If your parents use drugs, you're more likely to use them yourself. So that being said, I think it'd be interesting if we did a genogram. Okay, a genogram is kind of like a family tree. It's a diagram, something that's used for a lot of different things, maybe for health care, like if you go to the doctor for heart disease or something like that. For mental health, maybe to see if there's depression that runs in your family. There's one for you. One for you. You guys have any questions so far? Okay, for our purpose, we're going to use this genogram to try to track any addiction that we might have in our own families. Okay? And I was going to let you see mine just so you have an example. This right here is me, and this is my spouse. Square for female, circle for male, and for you it would be the opposite. because me would be square. So it'd be square for male, circle for female, right? It's me and my spouse. And this is my father and my mother. My father was a heavy drinker. My mother did not drink. Her parents did not drink. Now my father, his mother was a heavy drinker. You guys understand? Mind filling it out? If there's anything you guys don't feel comfortable sharing, don't feel like you don't, that you have to. You done?
Yep.
Mind sharing? Cool. Love that handwriting. So it looks like your father was a drinker, your grandfather.
Yep.
Do you remember them drinking or
Yes, all the time.
all the time? Well, when you look at that, do you see a pattern? You know, down to you.
Yep.
Any thoughts about that or any questions about that?
Just seemed like the way of life, the way everybody lives.
Right? So you feel like maybe that's just normalcy, you know?
Mm-hmm.
Just the way things are done according to you, you know? Can I see yours? Can I see it? So it looks like this is your mom,
Mhm.
right? And your dad. It looks like both of them drank. Your mom used some cocaine. This is grandmother? Grandfather. And he was heavy drinker. Okay. What about you? Do you see a pattern?
Mm-hmm. I know both my parents drank a lot. They had hard lives, so our kids were young.
Yeah.
And I'm sure
A
that
lot of
was,
stress, yeah.
and then on my mom's side, depression runs in the family.
Both
My
the
grandmother
stress,
had,
you know.
if she had an addiction, we didn't know it very well, but I do know she suffers from depression very badly.
Bless her heart. Well, that goes back to what we were saying, you know, in our risk factors about mental health issues and stress, you know. And it all ties into a pattern, biological, genetics, hereditary. You add in the environmental stressors, of work, having children young, like you said, you know. And so if you're presented with that situation and maybe you decide to drink a couple beers to just deal with that stress, or to do a line of cocaine just to deal with that stress. And it feels really good the first couple times, and then maybe some of those changes happen to your brain. And you're not even doing it just to have fun anymore, or to escape your reality anymore. You're just doing it because if you don't, you're going to get sick. That brings us to environmental factors. Remember your risk factors paper? You guys still got it? Okay, so from what we talked about so far, can you guys come up with any environmental risk factors that might contribute to addiction?
Struggles financially,
Definitely.
mental health problems cause you to act out, which might cause abuse,
Sure.
and then that can cause you to want to cope.
Definitely, yeah. some might say that's also biological, but definitely if you know it causes you to abuse, then yeah. Or if it causes you to be abused by your mother who was depressed, you know. What about you? What do you think? Any thoughts? Any ideas?
It's just like you do what you see when you grow up.
Mm-hmm.
Long chain of people acting crazy and doing their thing.
Mm-hmm. So again, you feel like you just learn ways to cope by watching how other people cope.
Somewhat.
Yeah, I think that makes sense, and
I
that's
think most of my drinking's been to have a good time.
for sure. Yeah, that too. It's definitely fun to have fun, right? Well, that being said, do you guys think that you can come up with any kind of triggers that you might have that might make you want to drink? Maybe it's because you're bored, or maybe you hear a song that you like. Maybe you just tired of dealing with the fact that you're broke. You know, any ideas? Any thoughts?
Holidays.
That's for a lot of people. Mm-hmm.
Any kind of death or anything, something
Yeah.
that really makes you down.
That's a great
Losing
point.
a parent,
Most
grandparent.
definitely. So when you have a hard time, you know, sometimes you feel like you need to get some help to deal with that hard time.
Numb the pain.
Yeah. Or when it's the holidays, I feel like it's time to celebrate. And what better way to celebrate? You know? So what do you guys think about our little group? You like our first meeting? You feel comfortable here?
Yes, ma'am.
I know it's your first meeting, you know, I know it's hard to feel comfortable talking about personal issues, but like I said, I really want you to feel like you can say anything here, there's no judgment here, you know, because we're all here for the same reason, right? Okay, so today, we talked about addiction, why people use to begin with, the various reasons why people use. Maybe it's trouble at home, mental health problems, trouble in school, hanging around people who do the same thing. Maybe they started when they were young. We also talked about some of the biological factors, how your brain can be altered after you use for a prolonged period of time, how you don't just use to have fun anymore, now you use because you physically need to.
Come dependent on it.
Yeah, and the genetic factors, how there's actually a genetic component linked to addiction, you know? How children of addicts often can become addicts themselves. We talked about some of the environmental factors, how stress can influence addiction, how, like you said, finance, like you said, holidays. We talked about some of our triggers, how we like to celebrate, how we think it's better to deal with the stress of maybe grieving. I think you all made some great points, and I really appreciate you contributing. Next time, I'd like you to, until between now and our next meeting, I think it'd be really good if you guys could think about how the two factors can interact, how biology can interact with environment. You know, just think about that for the next few days, and then when we come back for our meeting next week, we'll have something different to talk about, right? Okay, I guess I'll see you guys next week. Thank you so much.
Thank you.
Thank you.